name is Nurse Mel. What's your name?
I'm Fiona.
Nice to meet you.
Nice to meet you.
So I'm going to go ahead and provide some privacy for us. So now I'll be doing hand hygiene with the hand sanitizer. Okay, so today we'll be doing a cardiovascular assessment. I'll be using my stethoscope. It'll be go under your shirt, and we'll be listening to the valves of the heart. I'll be assessing the arteries, carotid arteries on your neck, the jugular distension. I'll be checking your upper extremity pulses, lower extremity pulses, doing assessment on your capillary refills, edema, skin turgors, and all of that good stuff. So, is that okay with you?
Yes.
Okay. So first, I will go ahead and assess your temperature. Can I see your hands? Can I see your other hand, please? So you're warm to touch, and that is good. That's normal. Skin color is normal. Hair distribution is good. You have any difficulty with growing hair?
No.
Okay, that's good. Is it okay if I touch your forehead?
Mm-hmm.
Okay, warm to touch, so that's good. So now I will go ahead to listening to the aortic valve, which is on the right side, the upper second intercostal spot on the sternum border. And this is the S2 sound. So when we're listening to this, it's lub-dub, S1, S2. So this specific spot, the aortic valve, is S2. Is it okay if I go on your shirt?
Mm-hmm. Yeah.
Okay, sounds good. No murmurs. Okay, so now I will be moving to the left side. And this is the pulmonic valve. And this is on the left side, the upper second intercostal space, by the sternum border. And this is also the S2 that I'm listening to. And it is normal. I don't hear any murmurs. So now I'll be moving to Erb's point. This is the third intercostal space, sternal border. Sounds good. Can I go under your shirt, please? And now I will be at the listening to the tricuspid valve. This is at the fourth lower intercostal space, sternal border, at the sternum border. And now I'll be listening to the mitral valve at the fifth intercostal space, mid-clavicular line on the left side. And this is where you will listen to the apical pulse, and I will do this for 1 minute. Okay, I'll pull your shirt down. Okay, so everything sounds pretty good. I would say you're about 72 beats per minute, and that's normal because The range for the beats per minute is 60 to 100, so that's good. So there was no murmurs. Your heart valves sound good, and that's the whole point. We want everything to sound normal, everything good. Lub dub was good. S2 was okay. S1 was good. So now I'll be moving to your carotid. So I'll be assessing your neck. Can you move your head to left and right for me, please? Okay, can you move it up and down? Do you have any difficulty moving?
No.
Okay, so now I'll be palpating for your carotid pulse. Okay, that sounds good. Bounding +2. That's good as well. Bounding +2. And I didn't see any jugular distension when you were moving your neck. Everything looks pretty good. Everything's within normal limits. So now I'll be listening for any bruits on your carotid areas for your pulse. And I'll be using the bell of my stethoscope to listen to this. Okay, that sounds... Everything sounds good. I don't hear any swishing. That would be the typical sound if we're hearing for bruits, but there was no swishing, so that's good. So now I'll be moving to assessing your upper extremities. Can you move your jacket for me, please? So I'll be assessing your arms. Can I see your arms, please? Just looking at it, assessing the hair distribution is normal. Everything's within normal limits, no abnormal hair growth. So I'll be checking for skin turgors. Skin turgor is good. I'll check skin turgor on the other arm. It's good, less than 3 seconds. Now I'll be checking capillary refills, which is good so far. It's less than 3 seconds, which is normal. Everything is less than 3 seconds, which is good. There is no edema, there's no pitting, which is good. So everything is good, good hydration. So now I'll move on to checking the pulses on both of the arms. So I'll be checking the brachial pulse. I'll say +2, very bounding. Now I'll be checking the radial and ulnar pulse. Radial pulse sounds good. Now I'll be moving to the ulnar pulse. That sounds good as well, +2 bounding. All the pulses on the left arm were +2 and bounding. I was able to feel for everything. Radial pulse sounds good, +2 bounding. As well as the ulnar pulse. Everything feels good. Now the brachial pulse is good as well. Everything +2 bounding on the upper extremities. So now I'll be moving to the lower extremities. Can I see your legs, please? I'll be assessing the popliteal pulse on both of the legs. Everything feels good. +2 and bounding. Can I see this one, please? This one is good as well, +2 and bounding. That's good. Okay, can you take your shoes off for me, please? Okay, can I see this leg? Can I pull your leg pants up? So now I'll be assessing the legs, the hair distribution. Everything seems normal. The hair is normal. No abnormal hair growth. Do you have any difficulty with growing hair? Any problems with your legs?
No.
Okay, that's good. So I'll be assessing the edema. No signs of edema, no pitting. Everything seems good. Is it okay if I take your socks off?
Yeah.
So now I'll be checking for skin turgor. Sorry, I moved that right there. I'll be checking for skin turgor. good, less than 3 seconds, so that's good. I'll be checking the capillary refills. All good, less than 3 seconds, that's good. Good hydration flow through the legs, and I'll be checking the pulses. I'll be checking the posterior tibialis pulse. I have difficulty saying that, tibialis pulse. Sounds good, +2, very bounding. Great pulses. Now I'll be checking the dorsopedis pulse. And that is good as well. Everything is normal with this leg. So now I'll be moving on to the next leg. Okay. This way. Now I'll be assessing the leg, assessing the hair distribution. Everything seems normal, no abnormal hair growth. Any difficulty with this leg? Okay, any abnormal hair growth? Okay. So now I'll be checking edema, no pitting, no signs of edema, which is good. Is it okay if I take your socks off? Okay, I'll be checking skin turgor, less than 3 seconds, which is good. Good hydration. Now I'll be checking capillary refills. And we're expecting to see less than 3 seconds, which I'm seeing, which is good. That's what we expect to see. So now I'll be checking the same pulses that I did on the other leg. The posterior tibis pulse. I have difficulty saying that word, but it's good, +2 bounding. And same with the dorsal pedis pulse. And that's good as well, +2 in its bounding. So everything with the leg is good. I says capillary refills, hair distribution, color is warm to touch. Everything seems okay. Both legs were warm to touch. I didn't have any difficulty with any of the extremities. So how do you feel?
I feel good.
You feel good?
Yeah.
Any questions?
No.
Questions? Okay. Well, I will say make sure you stay hydrated because your skin is normal colors, and I want to make sure that everything stays normal. So that's good. Palms were good, feet were good, color was normal, assessed. Yeah. Your skin was warm to touch, which is normal, so that is a normal finding. So if you have any more questions, make sure to call and come to the hospital for any more checkups if needed. So thank you.
Welcome.
So here are your socks.